Joining me now in the studio, we've got the lovely Whitney from Public Health Cornwall, and today we're discussing vaccinations. We're all dosed up here at Chaos TV, and I'm referring to COVID vaccines, I must say. Whitney, thanks for taking the time to join us today.
Well, thanks for having me this morning. It's great to be here in real life.
It is, just to start things off a little light, because we like to get everyone involved with things. That question for the nation. It's important. We all know it's an important one.
Oh.
What's your choice on the matter?
Oh, I do a lot of streaming.
Do a lot of streaming. I think that's where things are going towards, isn't it?
I know.
The recording one gets me. It's like the live TV, but it's not quite live. It's been recorded, but it's also not on demand. So I don't know who does that these days. As Nathan would say, who, you know. But anyway, we'll get on to the more important things now. So you work with Public Health Cornwall. What is your role?
So I'm an advanced public health practitioner, and my role is around screening and immunizations.
Oh, wow.
And so I work in Cornwall Council with public health, but actually I work across our partners in the voluntary sector, the NHS, trying to ensure that we all have access to our screening and immunizations throughout the county.
Really busy bee then?
A little bit.
Talk to a fair amount of people. I can imagine there's a lot of debate as well, a lot of conversation.
Yeah, well, and I think that's actually good. I think it's really good that people have questions, they want answers, because they're really curious and they're interested in what's going on, especially for COVID vaccines.
It's really good to have an open, honest conversation at the end of the day. It's the only way we can share our information together. Obviously, we've had a lot of COVID in Cornwall the past several months. Do we actually need the vaccine now? Do we not have herd immunity? Quite a common question we get.
No, that's a really good question. In Cornwall, actually, we've done such a great job throughout this whole pandemic, actually suppressing the virus down here, compared to lots and lots of our friends and neighbours throughout the country. Therefore, we just haven't really had it. And actually, we're not even close to herd immunity in our population. Wow. It feels like we are now because we're seeing it more and more. So absolutely, we still need these vaccines. They're excellent in protecting us from serious illness and death, really. But also, it reduces the symptoms of COVID, so you don't get it as badly.
Absolutely, and I think a lot of what people maybe is making people think now we've got that kind of herd immunity is almost the normality that we're getting back to, and everyone feels like they're mixing more now without any issues. But I suppose it's very easy to say, oh, I haven't seen it, therefore it's not there. But equally, I think we are getting to the point where we all know someone who's had the symptoms or has had COVID, and you've got to remember that part of it too. It's a very interesting conversation. A lot of it is about perspective, I think, and you've got to try and look at it from all the perspectives. I find it very hard sometimes. Now, I want to go towards the children's side of things now, because I personally have seen a couple of schools actually being closed because of infections taking over certain schools. A lot of children are getting COVID, and again, the question comes, because of them all mingling together, don't they have herd immunity?
No, it's a really good question. And the first thing is, actually, schools are not necessarily closing because COVID's overrunning. Actually, schools are incredibly good with their prevention measures, and they do everything that they can. Oftentimes, it's that they may not have enough staff to safely stay open because a few staff are off with COVID. So it's just something to keep in mind, that it isn't overrunning, but certainly we have it in schools. And so do we want kids to get vaccinated? Absolutely. What we know about the vaccine is that it's absolutely safe. There are side effects. You might feel a bit rubbish. But what we know is that it prevents serious illness and disease, and it interrupts transmission is a really important one. Not for everybody. It's not 100% for anyone, but it can help us sort of reduce that transmission in schools. And what the vaccine actually does is it's really predictable. We know how we're going to respond to it, but this herd immunity, our natural immunity that we have, is actually really unpredictable, and you don't know how much protection you have or for how long. And actually, we have better information about how these vaccines work versus a herd immunity. And the other thing to think is, actually, we have 25,000 12 to 15-year-olds. We're not even close to herd immunity there either. It's change, just a bit of change in terms of our cases amongst that group at the moment. So it's really, really important we get them vaccinated.
One thing you actually said there, I want to add in, if that's all right. You talked about the side effects and also the fact that it's not 100% effective. And I feel like that's been a massive focus on a lot of people's minds in making decisions about, is it worth it? But And would I be right in saying that's the case for a lot of different vaccines as well? Like nothing's really 100% effective at the end of the day, is it?
No, you're absolutely right. So all vaccines have a bit of what they call failure to them. And it's not really a failure necessarily. It's that some people just won't respond in the same way as everyone else. And that's across all vaccines. But actually the COVID vaccine is a heck of a lot more effective than a lot of others we've got. It's more effective than flu, for example, in preventing disease. But also get your flu jab. I'll tell you more about that today.
Oh, okay.
But it is the case. You can still get the disease.
Yeah,
the purpose of the COVID vaccine is to interrupt transmission and prevent that serious illness and death. So as much as possible, we want people to get that jab.
I really wanted to talk about that part because I feel like that's something that's just not been seen in any media, is the fact that everyone seems to be almost there's been a lot of demonization of the COVID vaccine. And I think, well, actually, how do other vaccines work? I mean, it doesn't take much looking into it to find out, oh, actually, there's a lot of similarities.
It's important to know that you can still get it, so we still need to be cautious and protect ourselves, but also that if you do get it, you get it much less severely. And there's an incredible study that actually came out yesterday saying that if you get it and you're vaccinated, you're so much less likely to pass it on or be as infectious to other people. So we're actually protecting other people as well as ourselves with this.
Exactly, 100%. What would you say to someone that's had their first dose of AstraZeneca, but maybe they're worried about getting their second one? And what would you recommend?
No, I think this is a super good question, because when AstraZeneca first came out, it was great. We were all super excited. And then this issue about blood clots came out. So everybody got a bit nervous. They changed the age range. What I would say is that if you had your first dose and you're a bit nervous about getting that second dose, for whatever reason, just book in or go to a walk-in center, speak to one of the clinicians. It is not the absolute rule that you have to have AstraZeneca as the second one. It just needs to be a conversation with that clinician, and it's very likely that you could have a different brand of vaccine.
That's really nice to know that there's that conversation available there and there's an option. Because I must admit, personally, when that came out, I was 31, 32 now. I was 31. It was saying, you know, up to, was it 30 years old, we're now looking at giving the different vaccine.
Sure.
And when I was going to the clinic, I thought, I'm 31. So I know it's a very small chance. It is a very small chance. But I thought, it's still that chance. And if I've got an option of a different vaccine, then I would rather take it. So when I walked in, my first question was, which vaccine am I going to get? And I believe I was talking to the matron, and you could tell she was very stressed, and she was in a very serious mood, but still getting on with the work. I could not, thank all the staff there enough. But she goes, "You're getting the other one. I can't remember the name of it now. Pfizer." Yeah. And when she said that, I went, "Okay." Just sort of, okay, you know what you're doing, you are in charge here, you are boss, and that's fine. But I was happy to hear that, and I was going to bring it up. So it's really nice to see that, that kind of thing. If that was my only option, and I was told I was going to get AstraZeneca, and that was my only option, I would have still went through with it, because versus the alternative of not having the vaccine, and the possibility then, a huge possibility of an increased chance of getting coronavirus, and then all the horrible effects being worsened, and obviously passing it on to other people. I've got a 72-year-old mum at home. My other half has got a family that are vulnerable, and it's not worth it.
Yeah,
not
absolutely.
Worth it at all.
It's absolutely worth it. And getting that second dose of AstraZeneca, the risks there are far lower than actually the risks of getting COVID itself.
Exactly.
So it's really important. If you haven't already had your second dose, we're a bit low in the county. We have incredible high uptake of vaccines, but actually we're a little bit lower in some of the age groups for that second dose. People aren't quite coming forward thinking, oh, I've got one, I'm protected. But actually, I know everybody's feeling a bit like a pincushion, but it's so important to come back for that second dose.
Absolutely. My other half is not keen on needles at all, but she still goes and gets them.
Yeah.
I am there. I like it when I go in. You'll quite find this funny. The staff go, "Oh, it's lovely that we're here supporting your other half." And I'm like, "Yes, support. No, I'm here to rugby tackle when she runs."
But I have to say, the staff are really, really good with people who are worried about needles.
Yeah,
they're absolute professionals, and they handle it so well.
It's absolutely fantastic. So, why do some people need a booster?
It's a really good question. So, I said that vaccines are really predictable. And so what the studies have been doing, since the vaccines were created is look at how long the immunity lasts and how long the positive effects last. And what they're finding is that for the very old and those who are the most vulnerable to COVID, that vaccine protection starts to wane a little bit. And so what we want to do is make sure that we give those folks an extra boost of protection as we move into what could be a very serious winter.
Yes. Yes.
Last winter we were all locked in our homes. We weren't wandering around. We weren't getting flu, colds, as much coronavirus, because that was the point. But this winter we've got lots and lots of our mobility back, don't we?
Yes.
So we want to make sure those who are the most vulnerable get access to that increased protection this winter.
Please correct me here if I'm wrong, because I don't want any wrong information going out. Would it be safe to say that, considering we hadn't gone out so much last winter, we get immunity a lot of the times naturally from just being in contact with different viruses and whatever's out there, and sometimes we're lucky enough to get that without actually getting the effects? Would that be the same? Would have been similar in a normal winter where we're going out and people are getting colds and flus? You get a little bit. Would it be now a heightened risk of catching things because we haven't had so much of it in the previous winter?
Yeah, it's very possible, and so that's what we're preparing ourselves for.
Okay.
And we know that these sort of winter respiratory diseases are very likely to kind of swirl pretty hard this winter. So what I would encourage people to do is, if you're eligible for any of the doses for the COVID vaccine, you get it. Excuse me. Flu vaccine is really important, and I think before COVID nobody really thought about this, but actually flu is incredibly dangerous,
yes,
especially to vulnerable groups, and we do have deaths from flu every year. So if you're eligible, get your flu vaccine as well. It's very likely you could get one in each arm when you go in. Not that you want to feel like a pincushion, but you can get it done in one sitting and get it over with. You might have a couple of heavy arms, but it's really, really important that you take up those offers, because while most of this pandemic feels a lot out of our control, this is one thing we can absolutely control, and we can protect ourselves and others by getting these vaccines.
Fantastic, thank you for that. I mean, my co-host on Tuesday, Rossi's now going to be getting the booster jab, so we actually had a nice little chat about that off air at the time. But it was nice it's nice because everyone in this building, and a lot of people I meet now, are all very much on top of getting the COVID jab. Even people who are really not keen on needles, just don't like medical stuff in general, but everyone's just, let's get it done. Just get it done. So, going to move on a little bit here now. Just trying to find where I've got to it. If someone is going to get the jab now, because obviously we've had lots of walk-in days and we've had lots of times where it's just been booking, at this point in time, how would somebody go about going to get a jab?
Right, so for your first and second jab, check out the Grab a Jab website. Just Google
nice.
Grab a Jab, or you
like
call
that.
119, and that will show you your walk-ins. There's also the national booking system that you can access online, but if you don't have access online, call 119. You can book in for first and second jabs,
okay.
And they'll let you know about so the walk-ins as well. So first and second jabs, don't be shy. If you haven't come forward yet, we're always happy to have you. The offer is always there. It never goes away, so it's really important. There's no judgment here. We're happy to get people
Fantastic.
in. For the booster, you'll be invited in. So that might be a letter from the NHS. It might be a direct invite from your GP, and you'll be able to book in where is convenient. Either your GP, many pharmacies are offering it, and the mass vaccination centre at Wadebridge, and there'll be another one at Trelisk in Truro as well. So there's lots of options out there, but you'll be invited. Now, what I should say is, don't panic if you haven't been invited yet. So they do it in sort of risk order, and you have to have 6 months between your second dose and this booster dose. So it's not been 6 months yet, you won't be called forward, and that 6 months is the bare minimum. So if it's a bit past 6 months, again, don't freak out. It's okay. That time in between doses is actually really important, and actually a little bit longer is a little bit better. So don't panic. Wait for your invitation, and you'll be able to book in.
Fantastic stuff. Now, obviously, we've talked about the flu jab here. I want to ask something, because I find I've got asthma, at least. Apparently, I still have asthma. I have not, thankfully, fingers crossed, I've not felt the effects of it for a very long time, and I've even started running now, folks. Yes, we won't even go into that now. But I therefore get some priority on getting the flu jab. My mum, 72 years old, the list along with her arm of different ailments, also gets priority for flu jabs. I've never seen the other side where people get it who haven't got priority. What would you say now to people about getting the flu jab in both priority and non-priority?
What I would say is those who are eligible are the ones who are the most at risk, and so they are eligible to get that jab through their GP or their pharmacist, and they'll be invited to do that. It's really important that those people are able to get their jab first, because they are the most vulnerable. But if you would like extra protection this winter, you work in a role, let's say health or social care, where you work with vulnerable people, you're also eligible to get that jab. So just so everyone's aware. But if you are in another profession where you think, gosh, I'm around people all day long, I want that extra protection, you can actually rock up to a pharmacy and pay for it yourself. You won't get it for free because you're not on the eligibility list.
That's fair.
But you can actually go and get that protection if you'd like.
I don't suppose you know the cost of it roughly at all?
Oh, it's different depending on different pharmacies.
Fair enough.
Yeah.
Fair enough. One thing I find interesting about that is we're talking now about the flu jab and how eligibility and how that's been a thing for plenty of years. and that's normal for us. And yet we look at coronavirus, and we're looking at coronavirus, the vaccine, with eligibility, and there's a massive light being shone on it. And it's like, well, compare that now to flu, and it's like, well, actually, guys, this is what we've been doing over here for years. Why are we shining a light now? Why is it such an issue? I find that one quite interesting myself, personally.
Well, I think everything feels really new because this pandemic thing has just exactly shown a light on these infectious diseases where we kind of didn't really pay attention to them previously. It was kind of like my gran used to get a flu jab and that was it, and no one really paid attention. But it's really put infectious diseases in a different light, and people are asking questions now that they weren't asking before, which is great because it makes people think about it and makes people actually pay attention. But yeah, I think it's just sort of now in everybody's consciousness, isn't it?
Yeah,
it's a
absolutely.
different scene these days.
It's strange, but as long as we get the right information, it always comes back to misinformation, doesn't it? As long as we get the right information, that's the main thing. Why should 12 to 15-year-olds get the vaccine?
Oh, it's a good question.
I'm
so excited about this question. Okay. So you will have heard there's all this controversy about the 12 to 15-year-olds. This is my favorite. So the Joint Committee on Vaccination and Immunizations, that's a mouthful, JCVI, said there's only marginal health benefits for an individual child to get this jab. So they said, we probably don't recommend it because there's not a huge benefit to them.
Right.
But the chief medical officer actually, what the chief medical officer does is look at this in the round. So all of the benefits, not just individual benefit.
Got you.
And one of those benefits is actually keeping our kids in education. The past more than year and a half has absolutely disrupted children's education. And so that's one of the main goals, is to make sure that we can keep kids in school, they're not infected, they're not passing COVID on to their friends and family. We can keep them in education as much as possible. We talked about it is in our schools, and we know that there are some closures here and there. So that's one of the reasons. And actually, vaccines are the #1 public health intervention that we have. And even though kids don't get quite as seriously ill or die as much as adults and more vulnerable from this disease, actually they still get seriously ill. They may not be in hospital. And we don't know enough about things like long COVID to say, let's just let it blow through all our kids and let everybody get it. So it's important that we protect our kids with every sort of defense that we have, and these vaccines are absolutely that.
Indeed. I've actually got a question I desperately want to come back, and it's actually personal to me as well, but I won't do it right this second. I'll probably do it at the end. It's about long COVID and something similar. Can you talk about how 12 to 15-year-olds can actually get their jab?
Yeah, absolutely. So we have a school immunizations program already. It's been running for many, many years. It's run through our colleagues from Curno Health CIC, who already deliver flu and HPV in our schools every year. So it's exactly the same. So it's not like the adults where you can go on a website, book in, or rock up to a drop-in center. It's run in the schools, and it's between the schools and the school IMS team to decide on dates and things like that. So you as parents and carers will be contacted via the school when it's your school's turn and your child's turn to do all the consent process, get all the information and all of that. So it's not just open wide for the booking, it is school by school.
Fair enough. And one thing I wanted to quickly go to there is the consent part. I was doing the morning news here at Chaos TV one morning recently, and it came up about talking about how they're trying to give some teenagers more say over them getting the vaccine than their parents. Didn't get to read too much into it. That was basically all I saw, and I thought, oh. So is there anything, could you shed a light on that one at all?
Yes, I would love to. So this is a really important one. So this is not new, this ability for these 12 to 15-year-olds to be able to give consent for themselves. This is what's called the Gillett competency. And it's been around since 1986. It's been law since 1986. So actually, but you can see how rare it is that it's happened because people didn't realize it was a thing. But because coronavirus vaccine is new, everyone's very, very concerned, and we want to protect our kids, so we ask these questions. So Gillett competency is basically if a child comes forward and says, I want this jab, but my parents or carer have said no, the clinician needs to assess that they are competent and capable to make that decision, that they understand the consequences, the benefits, etc. So that is there. It's really rare that it actually happens, and I have to say that if a parent or carer says, I don't want my kid jabbed, when the school IMS team are in the school, they will not jab them in the school. They will say, okay, even if the kid says, oh, I want it, my friends are doing it, I want to do it too, it'll be fun. And what they'll do is actually, they'll speak to the child, they'll get the parents and carers involved, they'll have a chat. They'll see if they can work through it, come to an agreement. It's
nice.
not about overruling the parent at any cost.
Okay.
It is about making sure that child understands what they're getting themselves into.
Would it be the same way the other way around as well? So the parents want their child to have or the teenager to have the jab, and the teenager doesn't want to have the jab?
Yeah, in this instance, it wouldn't be. So if a parent or carer says no, the clinicians won't be. Yes, if the parents or carers say yes, but the child says no, they won't pin them down and stab them.
Okay, I'm with you. Fair enough. Just thought I'd ask, came into my head, I thought, what about the other way around? That's a horrible thought right there.
We won't be doing that one.
No. So going on to the side effects now of the COVID jab, could you talk a little bit about them? And is there any differences between the main two that we have? We have three now, actually, because we have Moderna, don't we?
Yeah, we've got Moderna, we've got Pfizer and AstraZeneca, and there's actually another one, there's a fourth one called Janssen, but we don't really get it. There's not much supply of it, and we've got loads of the other ones to be able to use. And so the side effects are very much like feeling a bit fluey. So in where you get your jab, so it's called intramuscular, so it goes in the muscle in your arm. You might be a bit sore there for a couple of days. It might feel a bit warm, and you feel just a bit rubbish for a couple of days. It really usually only lasts a couple of days, but if you're feeling like after that you still feel really rubbish, give your clinician a call. Say, I don't know what's going on here. I still feel a bit yuck, and let them know. But really, for the vast majority of people, it lasts a couple of days. For me, when I got mine, I was cold, cold in my bones. I was really cold and just really tired, and I went to bed. But everybody has slightly different, but really most of the side effects are over with it within 24 to 48 hours. I'm
with you on that, and then lots of the side effects that you see the things in the news like, oh my goodness, one of the side effects is something super, super, super horrible. And while that may be true, what the reality is, it's like one in a ridiculous amount of people.
It's a really good point. And if you want to see all of those side effects, you can pop onto the website. There are flyers available when you go and get your jab. They'll give them to you. You can see every single one. It tells you the 1 in 10, 1 in a million chance. All
literally
the different
the whole
ones
list of them.
And again, for people who have different varying conditions or risk factors, your clinician will talk to you about what might affect you.
Absolutely brilliant. I remember I was very lucky. I was one of the very lucky ones. I talked to everyone who had the same vaccine as myself, and everyone said at least one of them, they had some serious flu sort of like symptoms, and they'd gone over it in a few days, but it was very severe. I had nothing.
Yeah, it's crazy.
So lucky.
People react so differently. I know loads of people who had no side effects at all.
All I had was just what you said. I had a little bit of heat coming from the arm. It was a little bit of pain. The first one, I had a bit of a weird one. I had a little bit of numbness going down my side, and I just thought, oh, here we go, whatever. Sort of, side effects. I'm one of those people who's just not that worried. Clearly, it's been researched. Clearly, no one's what they're doing. I'm just like, okay, sure. I'm expecting. I'll probably have a couple of days off work. Woohoo! No, it didn't happen. So I was still here at Chaos TV. Not that I don't like it. But just one of those things, and everyone reacts different. I think people need to remember that every person is also different. Yes, we're all humans, but we are all slightly different in our makeup. And we're all going to slightly react differently to things.
And it's important to say that no medicine or vaccine is without any risk. So there is some risk to it, but what we know is that risk from COVID and the possibility of long COVID far exceeds the risk to having the vaccine.
Fantastic. I want to ask, so this was something that came up in the news again. I was reading one morning, I thought I really wish I knew more. Quite a common thing, I wish I knew more about the news that comes in sometimes. There's been some reports of heavier periods amongst women who've had the jab. It's been already stated that there is no link between the two. However, it's still being looked into for reassurance, which, by the way, I think is fantastic. It may seem a little bit wasteful of resources, but at the same time, I think maybe not, because you don't want people to start panicking and worrying, and that's how misinformation could start as well. Could you tell us a little bit about that?
No, that's a really important one to pick up, because I know that it's one of the reasons that some of my female friends and family haven't gotten the jab yet, or some of them delayed when it first came out. So what we know is that there have been reports of heavier periods after they've received the jab. I don't know if you've heard about the Zoe app. So there's a big study out there that if you don't have it, download it. It's really, really good. It's a huge study by some big universities in the UK, and you can enter in your symptoms, what's going on, your vaccine, all of this stuff. And actually, that's how it got picked up, was that some women were experiencing heavier periods after their jab. And so it's University College London is the lead institution, and they and other colleagues are looking into it to see, what could be the possible link there. And it's really important that we do that, because these vaccines are new, and it's with any new vaccine or drug, there have to be ongoing investigations into what's going on, how they're being used, what the reactions are, any side effects. So this is one of the things that's being picked up and explored, which is really, really good. It demonstrates that we're committed to the safety, that we're not just going to dismiss people when they come forward and say that they've had some side effect that maybe wasn't in the pamphlet. So it's ongoing. At the moment, they don't think that there's a link, but I think we should be assured that it's being investigated, and we wait to see the results of those investigations.
Well, that's fantastic. And what about if there's anyone out there who is pregnant or planning on becoming pregnant? Can they get the jab?
They absolutely can, and I would absolutely recommend it. Probably a lot of what's been in the media this week is actually around trying to encourage pregnant women to get the jab, because about a fifth of people who've been in hospital with serious illness from COVID are pregnant women. And it was down to that first messaging when the vaccines came out. It wasn't at first they didn't recommend it to pregnant women because it's not tested on pregnant women, first of all. And we waited until there was lots of data from other countries. Millions of pregnant women in the US, for example, and Israel have had it very, very safely. We've got all of that data now, and what we want to do is encourage women to take it, because that a fifth of women in hospital with COVID is really scary. And the side effect of that is actually preterm delivery for baby. Can be really, really dangerous and have serious long-term effects for both mum and baby. So we want to make sure that they don't get it in the first place, and if they do, they don't end up in hospital in a serious situation.
Oh, fantastic. Thank you for that. I'm just going to ask that question now that I wanted to ask about long COVID. One of the side effects, at least going back a while now, that I heard, or say side effects, one of the symptoms of long COVID I've heard is fatigue. And I've heard about chronic fatigue syndrome, and everyone in the office right now is probably going, oh, he's asking about this again. I have chronic fatigue syndrome. I've had it long before COVID, and I found it wasn't something that was greatly researched. Is it something that is now becoming on the rise a little bit from having coronavirus? Well,
absolutely, fatigue is one of those on the list of long COVID symptoms, and we know that there's lots of studies going into long COVID at the moment. I don't think we know enough to say that definitely fatigue will last this long or that long, or but it's certainly one of the side effects of having COVID that we're looking into, and other things are around breathing difficulties, changes in your brain, changes in your heart. COVID is pretty nasty, and even though it feels like an eternity that we've been living with this thing, it's still very new, and we don't know enough about the long-term effects yet. So vaccine's important. Try not to, get it from others, hands, face, space, ventilation. These are really, really important things, even though we are so sick of it. The risk of long COVID is real and serious, and we don't know enough yet to dismiss it. So I think it's really important that we continue to look into it.
Well, it's very good to know that obviously you're looking at all sort of sides of things. Whitney, thank you so much for coming in and chatting. It's been really lovely to have a conversation with you about all this, and obviously vaccines in particular. It's so important, like we've both said, that we all talk about this, and we all talk about this in a safe way. Where could people find out more information about vaccines?
Absolutely. Go online to the World Health Organization website. So I think people are a bit skeptical sometimes of government websites, but the World Health Organization really holds governments to account, and has some of the best information out there on vaccines. You can also check out our Cornwall Council web pages, and we've got loads of signposting to really good information around vaccines.
Fantastic. Well, thank you so much, Whitney. It's been lovely chatting to you. We're going to throw back to the studio now and have a little bit of music. So we'll catch you in a little bit.